I'm absolutely delighted today to have Dr. Paul Litchfield here, who's an award-winning expert in occupational mental health and wellbeing, and he also is chair of the What Works Centre for Wellbeing. And a big thank you also to ITV for allowing Paul to come and speak to us today. I think this is a subject that is incredibly important with everything that's going on at the moment, mental health and resilience. So without any further waste of time, we've got an hour with Paul. I'm going to immediately hand you all over to Paul's very capable hands.
Thanks very much, Gilly. Good afternoon, everyone. Now for the most stressful part of the afternoon for me, as I try to share my screen and get the presentation up. So if it all goes horribly wrong, I'm sure my colleagues will sort me out. And I hope that now means you can see the screen. So as I say, good afternoon. What I've been asked to talk about today is mental health and resilience during a crisis. And I thought it was worthwhile getting a few definitions really sorted out before we get into that. So what do we mean by mental health? The World Health Organization makes it quite clear that it isn't just not being ill. It's more than that. It's about having a state of well-being that allows you to function effectively. And I think it's useful to think of mental health as a spectrum. So everything from being healthy and thriving through to being really quite severely unwell. And what we try to do as individuals and as organizations and as society is to help people to move down towards the green end of that spectrum and away from the red end. So if people do become ill, what is it that influences the chances of that happening? And there are biological factors, there are psychological factors, there are social factors. And the things that then influence those different factors are what you might refer to as the 4 Ps, if anyone was wondering what the P-pod was doing up there. And that's predisposing, precipitating, perpetuating, and protective factors. So what predisposes you to become unwell from a mental health point of view? Part of it is your genetics, that some people are programmed to have a greater susceptibility to mental ill health. Part of it is personality, which develops as a result of the way we're brought up in childhood and the other things that influence how we turn out to be what we are as adults. And then there are social factors too. And one of the most pertinent at the moment in the situation we find ourselves in is isolation. That does predispose to people having impaired mental health. Then there are precipitating factors, things that spark off an acute episode of mental ill health. And the sorts of things that do that are having something else wrong with you, like chronic pain, having difficulties with abuse of substances, whether that's certain drugs or alcohol. Then there are psychological factors, in particular stress being where pressure exceeds our capacity to cope with it, certain types of trauma, and then social factors, in particular things like bereavement and debt. And if you think about all of those things, they're all the sorts of things that we're experiencing more of at this time than we perhaps might do in more normal times, whatever more normal means at the moment. Then there are perpetuating factors, things which if you do become ill, prevent you from recovering more quickly and extend the length of your illness. And partly some people don't respond too well to medication, but then psychologically there's a behavior that some people experience, which is called rumination, which is going over things in your mind over and over and over again. And that can be deeply unhelpful if your mental health is impaired. And then there's the stigma of mental health, which again can help to perpetuate illness. So what can we do to protect ourselves? Physical exercise, good diet, just leading a healthy life all helps. In terms of the way that we think, we can train ourselves to think about things in a different way. And then having good support, in particular family support, is a strong protective factor for our mental health. So if we do become ill, what does that look like? Now, the commonest conditions that people experience, anxiety and depression, and something like 1 in 4 of us will experience a significant episode of anxiety or depression at some time in our lives. And often they're mixed, but the symptoms of anxiety are you feel on edge, you might feel a bit sick, or a bit shaky, you might have difficulty getting to sleep, you might feel your pulse racing, you're sweating, and you might experience panic attacks. Depression is more about your mood being low. That can manifest as being unusually tearful or perhaps unusually irritable. Perhaps the worst thing about being depressed is the feeling of joylessness. You just feel that there's nothing in life that makes you feel happy. You feel hopeless about the future. People will often, with depression, wake up early in the morning, so they feel tired a lot of the time, and they may well lose appetite and lose weight. And then there's more severe and enduring mental illness. That's very much rare, which some people call psychosis. That's very much rarer, perhaps affects about 1.5% of the population. So I won't talk about that unless people have specific questions, because in this sort of situation, it's most commonly anxiety and depression that we're likely to see. So what then is resilience? And essentially it's about bouncing back. So being able to withstand pressure, and then when things do go wrong, bouncing back fairly quickly to get back to your normal state. And you can't change a lot of the things that I described as predisposing factors. We're stuck with our genetics, and it's one of the many things we can blame our parents for. We're stuck with the way that we've been brought up. I mean, our personalities are our personalities. We can't change those an awful lot, but we can build on the protective factors. And there are all sorts of sets of guidance about how to improve your own personal resilience. I'm perhaps a bit biased. I had the privilege of serving for about 18 years in the Royal Navy, and dealt in that time with a number of special forces people. And one of the things that came through to me was that not only do special forces people have to build their physical strength, they also have to build their mental strength. So they have to endure a lot of physical challenges, but they also have to endure a lot of mental challenges. And the US Navy SEALs have put together these 6 techniques, which I just love the term bulletproof mind. It's, I think it's a great way to describe it. But what they talk about are 6 things that we can all do that will help to build our resilience. And the first one they call Eat the Elephant, which is if we've got something to do and it can seem overwhelming, how on earth am I going to cope with this situation? How on earth am I going to do this particular task? Break it down into small things that we can do in a short period of time, bite-sized objectives, and complete those one at a time, and be happy when you've completed that small part of it. And over time, what you'll do is you'll then break down the bigger thing and end up eating the whole of the elephant. The second one is about visualizing success. So all too often we know we've got something big coming up. Maybe I'm going to be doing a webcast to 150 people, and I think, oh my God, I'm going to make a complete mess of it. They can think I'm a total idiot. And that sort of negative feeling is quite damaging. So turn it around and say, okay, I've got the benefit of talking to 150 people here. Do you know, I've done this sort of thing before. Maybe I won't be too bad, and maybe even 1 or 2 of them will find it helpful. So it's taking a glass half full view of life rather than a glass half empty one. Then there's controlling emotions, and there are various ways to do that. Breathing techniques is one of the commonest, and that goes back into antiquity. If you think about what Buddhists do in terms of chanting, that's actually a breathing technique. So 4x4 is simply breathe out, hold it for 4 seconds, wait for 4 seconds, breathe in for 4 seconds, hold that for 4 seconds, then breathe out again. So 4x4 isn't a Chelsea tractor. It's about getting your breathing right, and that gets the stress hormones under control. Next one is reframing. So look at the way that we see things externally, and if we're seeing them in a negative view, in a negative way, try and challenge that and see them as an opportunity to help ourselves. Small victories is when things happen during the day, during the week, focus on the ones that go well, not just the ones that go badly. Of course, we can learn from things that go badly, but think about the things that have gone well too. It doesn't have to be anything great. I mowed the lawn the other day, and the council have stopped collecting the green waste. So I did it without collecting the grass cuttings. Thought, oh, it's going to look a mess. Actually, it looked all right. And I thought, hey, that's all right. Enjoyed that. And then there's the key thing about relying on others, relying on your friends, relying on that circle of people who share your values, share your views. Do take care of them and allow them to take care of you. And if you do those things, then your resilience will be very much improved. Now, organizations have a duty to manage stress, and I think often people don't realize that that is a legal duty. Just as it's their legal duty to keep you physically safe, it's also their duty to keep you mentally safe in the things that they ask you to do at work. And what I've put up here is a framework that we developed at the What Works Centre for Wellbeing, which ITV has now taken as its way of structuring what it does around well-being. And the concept is that these are the drivers of well-being. So these are the things that influence in a work context whether we're going to feel good or whether we're going to feel bad. And it's about more than health. So health is important, and mental health, physical health, and emotional health are all important, but so is security, that's physical security and financial security. So is the environment, that's the built environment we're working in, but it's also the culture of the organization. Relationships, particularly relationships with your manager, but relationship with your peers. And then purpose, having that sense that as human beings, we need to feel that there's some meaning in life. So what we've done with ITV is focused on those things, and I've just put examples up here. So at this time, making sure that particularly people who are having to work from home or are furloughed have access to mental health service and strengthening those mental health services for people that need them. In terms of security, thinking about the financial pressures that people are going to be under and topping up the payments to furloughed staff to make it up to 100%. Environment, a lot of people are working from home when they're not used to doing that. So giving them guidance on how to work remotely, not just the ergonomics, the physical structure of how to set up your workstation, but some of the psychological tips about what it's like working from home. Relationships, in a crisis, people tend to look to their managers. So making sure that managers are trained in recognizing distress and how to signpost help for that, but also peer support. And then finally, purpose. At this time, it's easy to lose the sense of purpose. What's life all about? So making sure that there's regular communications from senior leaders, explaining to people, just reminding people that, hey, look, it is important that we get news out there to the public, news from a reliable source. It's also important that we're providing entertainment to people who otherwise might be pretty miserable. So all those things will help to build well-being and manage stress at this time. But of course, I do recognise that some employees have to be laid off, so they won't necessarily have access to those organisational services. A lot of people in this industry are freelancers, and certainly what ITV is trying to do is do some things to help freelancers, such as this webinar, but there's a limit to what you can do because of the dreaded IR35 and people won't thank us in a year's time if they find they've got a huge tax bill. And a lot of people are going to have to look to their own resources, not just what an organisation can do for them. So what can we do for ourselves? And the first thing I would say is do look out for trusted sources of information. I probably get a dozen things a day at the moment in about how to manage my mental health during the pandemic, or how to improve my well-being during the pandemic. And some of them are excellent, and some of them, frankly, are snake oil. And it can be very difficult to tell the difference between what is a valid evidence-based program and one which is simply made up. So look for sources of information that you trust. I would point you towards what Public Health England have done with the NHS and charities in producing a set of resources called Every Mind Matters, and the link is on the screen there. And just, there's a wealth of information in there, but just pulling out some of the key points that come out from that. When we're in this situation where a lot of us are stuck in a place that we don't normally spend 24 hours in, establish a routine. It's all too easy when you're stuck at home to just doss around in your pajamas all day. So establish a routine, get things that give you some structure to your day. Think about things like exercise, what you're eating, that you're drinking sufficient amounts of water. This is, and see it as an opportunity. This is an opportunity actually to do those things that you keep putting off, like losing a bit of weight, or giving up smoking, or whatever it might be. Remember though, don't try to eat the elephant. Don't try to completely couth up your lifestyle all at once. You'll probably fail. Pick on one or two things that you want to do and do that. Stay connected. Connection is probably one of the most important things at the moment. As I said earlier, isolation is a huge threat to mental health, and we've got to be aware of that. We're lucky, much luckier now than we were 20 years ago, perhaps even 10 years ago. There are so many online platforms to allow us to connect as individuals, to keep contact with the people that we care about. It's easy enough if you live in a big house, a castle perhaps, with a west wing and east wing and north and south wings probably, to keep your distance, get your own time for yourself. If you're stuck in a small flat in a city, that's much tougher. So think about, if you're living with others, how you're going to maintain boundaries, how you're going to give each other some space, so that there will be times when you don't actually want to be with other people. You do want to be on your own. They will feel like that too. So think about it, plan for it. Don't beat yourself up. We tend, as particularly I think in the Anglo-Saxon world, to beat ourselves up a lot. Be kind to others, of course, but be kind to yourself as well. And finally, reach out. If you're not feeling good, reach out, speak to those contacts, speak to your friends, share how you're feeling, share your anxieties and worries. If you haven't got anybody, then there are all sorts of organisations that are putting their services out there at the moment. Talk to them. Talking to a stranger anonymously is sometimes easier than talking to people that you know, friends and family. And my last tip would be on the Every Mind Matters website, there is a little app which I have done, and I thought actually it's quite neat. It's really simple, but it's called Get Your Mind Plan. You do a quick quiz, and what it does is it throws up a plan for you that will help you to stay mentally healthy through these difficult times.